And this particular topic tonight, I think, is very, very important simply because it's probably the biggest hurdle that all of us in the practitioner world in natural medicine has to deal with on a daily basis, and becomes one of the biggest obstacles and challenges we have. And that particular subject really is the standard effects of the standard American diet. This particular talk will go into the in-depth markers of what represents that and to what degree it's affecting our overall health on all levels. So I hope that'll be information that you can use. I think it's valuable, and it also will give your clientele some good information as well when you can communicate this information to them. This slide I put in here, and I put a couple slides in here that I would normally not use, but because of the significance on a global scale, but as you can see, more significantly in the United States and Canada, this particular issue is way beyond the pale, particularly in the United States and Canada. And we're talking about, this is a company that does nothing but create statistics. It's almost like a group of, what do they call them? Insurance actuaries, if you know what they are. They're the people that dig in and do all the deep studies to figure out how long you're going to live so they can determine how much to allow to invest in people in terms of insurance, because they want to beat the game, hopefully, because this is in-depth. This is an in-depth study. The study's done. The study is disseminated, and they normally charge like $4,000 for this. This report, this in-depth report, they disseminate it to hospitals across the country, clinics across the country, and practitioners in the fields that you're going to see specifically mentioned, so that they can plan for the future. You know, I'm talking in the next 10 years or more, as to what's coming down the pike related to this one subject. So, global advanced glycation end products. And again, I'll give you the definition in just a minute. Here's the market according to this company. AGEs, which is the abbreviation for advanced glycation end products, dominates the percent of diabetic complications, 34%. Bone diseases, AGE, once we get into this, you may not always see the correlation between bone disease and AGEs, is significant. Cancer is very significant, and neurodegeneration makes up most of the pie for all of this. This is their projections and their forecasts based upon their studies as to the global advancement of the negative impact these AGEs, which, by the way, Inno-Vita now has a way to test for AGEs in your clients, which I think is exciting because you have a marker to see where they are, and then you can do a follow-up after putting them on programs. So global advanced glycation end products market, look at that. Steady incline. Of course, this being a company related to the medical profession, they also have dollars and cents. It's a $4.5 billion market. They expect it to grow minimally at 5.7%, and it's probably going to be greater than that. I'm not giving you this because I think you need it to figure out your marketing plans, which you could, but I'm giving you this more importantly to see the significance that this AGE issue, which is all related to the standard American diet, is impacting health. And this is something we have to deal with our clients to make changes and to try to improve their health. So you can read this. Market growth expected to reach 4.5 by 2030. Different types of measuring AGEs, whether you're measuring them on the skin, which they have a machine does, or they're measuring it from like urine, saliva, or blood. Diabetic complications segment claims over 34% of the market share associated with AGEs. So you got diabetics or insulin resistance or pre-diabetics, you better be thinking about these AGEs. Leading end user hospital captures 38% of the market share. So what are they telling us? They're telling us because of these AGEs produced from the standard American diet, 38% of the hospitals are going to be having, or 38% of growth is expected simply because of this issue. So they know those, the standard American diet is pretty much killing us. Age population, chronic disease propel it more. They say will projected 700 million people. It's probably higher than that. And again, the growth expectation. So this is a whole market this company does for all these hospitals and all these clinics to figure out how they're going to plan the next 3 to 10 years in terms of their systems and testing and treatment plans for the future growth of their companies. In 2023, the segment took the lead over 34% of the market share, particularly in the diabetic complications. So this is very, very, very common in your diabetics. And again, this is some of our biggest challenges in diabetics is about what they stick in their mouth specifically. So this is why there's an issue. And pretty much is what the statistics are showing. There's not much of a huge change people are going to do or have been doing to change that. And they also show that there's high related complications in neuropathy, retinopathy, cardiovascular disease, kidney disease, and cancers even. This is the new product that helps remove glycotoxins and AGEs. And by the way, I can tell you from using it, it's getting very good results. One other little tidbit I want to just throw in there is advanced glycated end products on the skin are the brown spots, or what people call the age spots. That's AGEs. And I can tell you, even personally, I've seen diminished brown spots on my hand, which I took pictures like 6 weeks ago, and I've done follow-up pictures to see the progression of it. So great product. We're going to talk more about how it affects this and why it's so important to be using this, but better also using the testing. What AGEs are is when sugar and proteins bind together with heat, essentially. And again, that's what AGEs are. They're protein and sugar that bind together from heat. So in other words, when you have that delicious creme brulee, you're just getting a really nice pack full of AGEs going on there. And again, the number of cancer cases in the United States is projected to increase to 19 million. So we're not seeing a decrease in cancer. We're seeing an increase by 2024. And they medically believe that AGEs are playing a huge role in contributing to that market growing. Glycation occurs when sugars, especially in high concentrations, react with proteins in the body, forming these glycation end products. So from now on, I'll just say glycated proteins. And these AGEs accumulate over time, so this doesn't all happen at once, but they do they're associated with high blood sugar, and you always see with high blood sugar more glycated proteins. But remember, one of the things I have to tell you, the AGEs you see on the skin are also inside the body. I'll say that again. The AGE, the brown spots, the aging spots you see on the skin are inside the body, inside the colon, can be on the liver, can be on the other organs as well. And again, there's many, many, many studies that you can go on PubMed, National Library of Medicine, associated with AGEs and pathological disorder. So again, here's a cue when you're saying, well, what would I use this product for? Well, if you have someone with dementia, Alzheimer's, diabetes, atherosclerosis, endothelial dysfunction that leads to cardiovascular disease, you might want to test your AGE levels on that particular person or test the product for that particular person. Again, a good shot of the product. And I specifically asked Brent to put the picture of the product in there more than once. So, cooking tips. The use of acidic marinades. Aside from cooking foods at lower temperatures, marinating meats with acid, lemon juice, vinegar reduces AGE formation. Did you know that? So marinating with lemon juice, and I will tell you, my wife is Greek, so lemon juice is put on everything in the house except for the furniture. But all food gets lemon juice. So, and the whole family. I've learned that from the years. Acid marinated meats can have and this is pretty significant. I mean, look at the numbers. 20 to 30% fewer AGEs than non-marinated meats cooked the same way. So, you know, innately, they learn to do something that's really healthy for them is, you know, putting lemon juice on everything they eat. So I would take that in consideration. AGEs also form when tobacco leaves are dried. So you get it, people get it from smoking. And during inhalation, AGEs and cigarette smoke can also damage the lungs. And you get AGE or brown age spots on lung tissue. In general, meats high in fat are prone to generate AGEs during cooking, especially under intense heat. So real high heat. So what you see on the steak when you're fast cooking the outside and it gets that dark gristly look, that is AGEs. I know a lot of people like that, but it is concentrated AGE formation, all from the combination of heat, protein, and sugar. Overall, prepared by similar, pork contains the highest amount of AGE. So some people say, well, do you recommend to eat pork? I'm not totally anti-pork, but when you consider this information, it's something worth considering and or emphasis on preparation or maybe marinating pork in lemon juice. And then followed by beef, chicken, lamb. Lamb actually ranks relatively low in AGEs. And what other meat do Greeks like to eat but lamb? Consumption of AGE source is fructose or sucrose. Soft drinks can worsen liver fibrosis faster than consumption of AGEs. So AGEs decrease the levels of cellular antioxidants and peptides. So this is important. AGEs diminish glutathione. AGEs inhibit SIRT1. And for those of you that were on my sirtuin talk 3 years ago, you know how important SIRT1 is. So the last thing you want is SIRT1 inhibited. And because if it is, you'll have increased oxidative stress, inflammation, and more promotion of it. And the other thing is fibrosis models in livers. So you got non-alcoholic fatty liver disease, that's your NAFLD. AGEs are highly associated and found in non-alcoholic fatty liver diseases. And let me tell you, that is happening in children today, fatty livers. So you must be thinking of this product besides the other factors as well. Foods with the highest AGEs are fried, barbecued. Boy, that gets me. I don't like barbecue. Baked or boiled, dry heat processed foods like crackers. Now, would you have thought dry heat processed food like crackers and chips and cookies have the highest AGE levels per gram of food in this group? I didn't, but a lot of people said, oh, yeah, that makes sense. So that's where you find a lot of them. These are found in a lot of soft drinks. High fructose corn syrup, of course, contributes to higher AGE levels. And high heat, again, as we mentioned earlier, prolonged cooking time enhances the amount of AGE production. So cooking can actually increase the AGA level in foods by 10-fold. So is the person, and you may not want to hear this, but the person eating the medium rare steak better off than the person that turns it into a hockey puck? They are. Skin aging is huge with AGEs. So we know that there are people who would love to be able to have something that can help decrease wrinkles, fine lines, dull and dry skin, and all the issues that come with what they call skin aging. And again, if you have someone like that, do the AGE test and see if this is a part of why they have all those wrinkles and fine lines and dull and dry skin. So you have a reason to use your product because it's justified if it's abnormal levels found. So skin aging is huge with AGE levels and skin health. Insulin resistance. So here's what you need to understand. Glycation will impair insulin sensitivity. So it contributes to insulin resistance and type 2 diabetes. So AGEs contribute to insulin resistance. It's not the other way around, particularly about AGEs. So we all know insulin resistance. And probably I would have thought before I did a lot of the research that insulin resistance might be associated with and or causative factor, but it's actually the opposite, whereas glycation impairs insulin sensitivity, so it contributes to insulin resistance type 2 diabetes. Diabetic foot ulcers are often produced more AGs, which can obstruct skin wound healing complications. So you'll find high AGs and diabetic foot ulcers. Arterial stiffness and atherosclerosis. So AGEs are found and contributing to arterial stiffness and also atherosclerosis. So if you got a client with cardiovascular issues, you need to be thinking about checking out the AGE levels and or consideration of using the product depending on how you test. This is a big one. Alzheimer's disease, dementia. AGEs play a role in the development and the progression of Alzheimer's. AGEs play a role in the development and progression of Alzheimer's, and as well as other neurological conditions. So anything else that impairs neurological function. So even if you're talking about ALS or MS or anything else. Glycation does trigger inflammation throughout the body. AGE also increases oxidative stress, which we all know oxidative stress contributes to inflammation and contributes to tissue damage and disruption of metabolic function. Kidney function is affected by glycation, for sure. Cataracts also are affected by glycation proteins. And of course, Parkinson's disease. I can tell you, I just recently had a person with Parkinson's, which is probably the worst case I've ever seen. Most people, you see hand tremors or head tremors. I'm talking about flailing arms. Yeah, the worst I've ever seen in 49 years. And one of the products we were using is AGE. Another product we were using, we will talk about in the next part 2 of this, that played a big role in making some pretty dramatic changes that actually surprised me quite a bit, because I honestly, and I told him, I don't know how much we could make a difference, but let's give it, he wanted to give it a shot, so we did. And it's been profound because the time frame involved, the short time frame that it affected it, shocked me probably as much or more than it did him. So that's very exciting. Again, the product, dietary AGEs, serum AGEs, binds to RAGE. RAGE is the receptor sites for AGEs, glycated proteins. And you can see the pathway. They upregulate NF-kappa B, which is what? That's a primary inflammatory gene that turns on all the pro-inflammatory cytokines. And then it goes down and causes more reactive oxygen. So it causes oxidative stress, more inflammation, which flips back up and also increases the RAGE activation, and then it also is associated with PCOS, obesity, insulin resistance, and also hormonal imbalances is worse. So PCOS is a big problem in a lot of women today. And I don't think many of us are thinking about AGEs as playing a role in the development and exacerbation of PCOS. So they're finding that AGEs are very common in the hepatic stenosis and advanced liver disease, and also in liver fibrosis and liver cirrhosis. Because AGEs can stimulate apoptosis, inflammation, cellular dysfunction, and ultimately non-alcoholic fatty liver disease. So all these people who are obese, a lot of them have fatty liver. Matter of fact, nowadays they're promoting, doing testing for fatty liver because they know if you're significantly overweight, the chances of you having fatty liver are very high. And again, I'm telling you, one of the things you have to address is the AGE levels, because those brown spots on the liver are affecting it and promoting non-alcoholic fatty liver disease. So this is one factor. I would not just use one factor. Again, in the next piece we're doing, I'll go into that more specifically. So very common in Parkinson's disease because there's activating NF-kappa B and TNF. Both are pro-inflammatory cytokines. But what is it they're saying here that it does? AGEs contribute to the damage of the dopamine neural death pathways, receptors is what it is. And so we all know if you have Parkinson's, you have low dopamine because that's a part of the disease process. And when you have lower dopamine, you will have Parkinson's. And so AGEs are contributing to that process, to that pathology. So think about it with all your Parkinson patients. And like I said, we've seen some amazing results with it. And again, it affects the microglia cells, which if you know what they are, they play a big role also in inflammation and immunity in the brain as well. And it primarily damages these dopamine receptors. And that's a big deal because you're trying to get improvement. I don't know how many of you do any kind of brain testing, which we do, but we find dopamine low in many people. So just the fact that it's low doesn't tell us why it's low. Now we have to test to see all the different pieces of the puzzle as to why would there be low dopamine. I'm telling you one of those factors, and I would say it's probably becoming a very common one, is this RAG or the glycated proteins. And again, the main area, or one of the areas that it damages, is the substantia nigra. And we all know that's the key area associated with Parkinson's disease. So it also contributes to the role in Lewy body formation and also tau proteins, which we'll see later on. They have studies showing that AGEs, because of the effect it has on oxidative stress inflammation, accelerates the progression of obesity. So they also know that AGEs play a big role in triggering, here's the relationship of being overweight and how AGEs are participating in causing that problem. Here's the answer right here. By triggering hypothalamic and insulin and leptin resistance, all three. Hypothalamic dysfunction, insulin dysfunction, and leptin resistance, insulin resistance and leptin resistance. And that leads to obesity and metabolic syndromes. So anytime now you're looking at trying to do something with anybody's weight where it's significantly high, you have to either test them for the AGE levels or you need to put them on something like this product and see if it doesn't help, along with some other support as well. It has been proposed that levels of AGEs dependent on production of dietary intake. So you have clearance systems in the body that are enzymes that help clear out AGEs. And they have a role in detoxifying AGEs. And that's what's so significant of this product, Inno-Vita's product that they've created, is to help activate those particular enzymes as well to help detoxify AGEs. Again, like glycated proteins enhance LDL uptake and in the human aortic intima cells. So it stimulates the formation of foam cells. And we all know if you stimulate foam cells in the intima lining of the blood vessels, that causes atherosclerosis. And it does this by enhancing LDL uptake. So AGEs are a part of the puzzle if you're trying to make any real significant change whatsoever with people that have circulatory problems, atherosclerosis, cardiovascular problems. I don't know how you can not test for this as well as whatever else you're going to be considering to use with those people. The other thing that AGEs do is they result in breaks in the DNA strand and cause mutations, which lead to the production of abnormal proteins. So people talk about DNA damage, DNA issues, and what is contributing to them. One of the things that significantly, they have lots of research showing this, that contribute to these DNA breaks and mutations is this glycated products. I don't know. I didn't think of this at the time when I was creating this PowerPoint until I ran across this, which I thought was very interesting, because personally, I never would have dawned on me to consider AGEs in the microbiome growth, or, it causes intestinal leakiness. AGEs cause gut barrier dysfunction, intestinal permeability. So what they're really saying is AGEs could be a causative factor in your leaky gut, which we've talked about for the last, 15 years. Everybody's saying, oh, you have leaky gut, you have leaky gut. Well, maybe what you need to say is you have AGEs is causing your leaky gut. Because remember, leaky gut is a symptom. It's not a cause. And I know that steps on some people's toes, but I will stand hard and firm that leaky gut is an effect and not a cause. And right here, AGEs contribute to that. AGEs disrupt the microbiota. They disrupt the microbiome, and they also damage the intestinal wall. Again, we mentioned this earlier, they disrupt hypothalamic function, and we all know if you have disrupted hypothalamic function, the hypothalamus controls energy control, body temperature, weight, cravings, obesity, metabolic syndromes. The hypothalamus controls the pituitary, which then controls the others. So the hypothalamus is so critical in function. And again, with our testing, I find out there's a hypothalamus issue, I would be using the hypothala with the AGE product if it tested positive as well. Okay, now we're getting into areas where I think it's important to cover this. Obviously, we're not treating, so this is my official caveat. We do not treat cancer, okay? So, but the research is saying AGEs, elevated amounts of AGEs, are observed in tumor tissues in cancer. They're observed in tumor tissues in cancer. So they know that there's a link to cancer initiation, progression, and migration, and metastasis. If you think about that, then you think about if everybody today is worried about, in an earlier slide, what did they say? They're expecting cancer to go up by 19 million people in the next year or so. They know AGEs are rampant in the standard American diet. They know AGEs are destroying our health on so many levels. So you now have tools to help detoxify these AGEs. I thought this was an interesting slide because they found that people with high receptor AGE levels are at higher risk for COVID-19 morbidities. Meaning if you got COVID and you got high AGE levels or high RAGE, which is the receptor sites, there's a higher risk for morbidities from lung disease, cardiovascular disease, and the list goes on. So something to consider. Again, this goes into advanced liver cancer diseases, fibrosis, which I am a big advocate in us having to address fibrosis in many organs and tissues, which we will have somewhat more of a discussion in the second part to some degree and relating it to the AGEs as well as the next topic we'll cover in part 2. So they know AGEs play a role in creating neuronal plaques in the brain. And they also affect cerebrospinal fluid, which is a big deal. And again, we already mentioned they suppress SIRT1, which is huge too. So inflammaging, that's a big deal in aging, which we all know. So they promote that. They're associated with obesity, diabetes, and we've already said that. This is important. AGEs are not target specific to one or two organs. They almost affect every organ with multiple actions in the body, from apoptosis inflammation to protein dysfunction. And protein dysfunction is huge, but also mitochondria dysfunction. And we already talked about gut health and how they disrupt the microbiome. There's also evidence in Crohn's disease showing high incidence of AGEs as well. And also they showed that it affects digestive enzymes. Oh, this is interesting. So in people, younger people versus older people with high AGEs, the point here is in younger subjects with high dietary AGE intake, the levels of the inflammatory markers were just as high as those persons older than 60 years old with lower dietary AGEs. So I can assure you the children are being affected significantly by this, which is a sad situation. COVID, we talked about how it increases morbidity in COVID, and we talked about how it downregulates SIRT1. And if you saw the SIRT2 program I did 3 years ago, you know how important SIRT1 is. It also causes dysfunction of mitochondria. This is an interesting slide. Reducing AGEs in the diet has been shown to balance hormones associated with acne. Now, that's something that I found, and I found it more than one study, but I thought it might be interesting. I wouldn't have thought of, AGEs, acne. Okay, women prone to hormonal type acne and anyone with inflammatory type acne should consider a low AGE diet. So the next time you have severe acne cases, which there are plenty of them out there, something to think about, something to consider. So we know it affects the lens of the eye associated with cataracts. We know it affects the cartilage. We know it affects the kidneys. And a biggie here coming up, it affects the extracellular matrix proteins, including lamina, elastin, collagen, damaging those things in your ECM, which is your cytoskeletal structure, and it does much more than that. So diabetic patients, it's critical. Muscles, bones, and cartilage, among others. This is where at the very beginning of this talk, I showed you, it was a pie and it showed you cancer, neurological diseases. But if you remember, bone diseases was in that category too, as far as the association of AGEs and their effect on bone health. I always like to go down to stem cells because it's very popular today. And I think stem cells have a phenomenal potential. Personally, myself, I'm not convinced stem cells are where they need to be to make the real changes they have the potential of doing, because I don't think they always go where they're supposed to go, which I know there's studies showing a lot of them end up in the liver. And I don't know that all stem cells that they're putting in people are that healthy. There's something called cessonant stem cells, which pretty much means zombie stem cells, and stem cell exhaustion. So AGEs help diminish stem cell function, bottom line. and again, the downregulation of SIRT1 and the promotion of fatty liver. And there's a product, and you have it both in capsule and liquid. I don't know how many of you use liquids, but I think we're probably, I'm guessing, but Dr. Kim would know from our purchases, we're probably 70% capsules or 65% capsules and 35% liquids. But we have a lot of people that like liquids. It's like capsule fatigue. AGEs and diabetes, definitely. If you got a diabetic, you got an insulin, you got a metabolic syndrome, you have to take a look at that. It causes insulin resistance. It causes cell dysfunction, retinopathy, neuropathy, cardiomyopathies associated with it, important contributors to atherosclerosis and damage to the heart muscle. And they are demonstrated as an independent predictor of both the severity and prognosis in heart failure patients. Again, this is from research studies. They do measure in the blood a particular metabolite, phenylcytidine, as a cross-linking agent to indicate how much AGEs are. That's another way to measure. And again, we talked about you have enzymes to clear and detoxify AGEs. Actually, two great products are for neuropathy that we found works well. Neurox with AGEs with the next product we're going to talk about next week. And here's where we get into the fibrotic organs. So there's fibrotic organs are huge deal, which is not talked about near enough, and no one knows, or I shouldn't say that word, and a lot of people are not aware of the significance of that. Again, it causes stiffening in the collagen, leading to high blood pressure, diabetes. It causes stiffening in the ECM. So all your people with stiff joints is damaged collagen, damaged ECM, been associated with strokes. And now I just want to show you some of the studies. Vascular effects of advanced glycated end products on molecular mechanisms. So these are just some studies. I gave you just a handful. SIRT1 resist AGE products. Unfortunately, AGE products downregulate SIRT1. So there is a product called SIRT2 you might want to test to help upregulate sirtuin-1 if you have an AGE issue. If you test to say, wow, do they have low sirtuin levels or low SIRT1? If they have high AGE, studies are showing there's a highly likely. And what else is activating NRF2? What product does Inno-Vita have for activating NRF2? And the answer is IntegraCell is a NRF2 activator, and it does a phenomenal job because I did a bunch of studies with it with my 34 staff people. Age and rage, metabolic molecular signatures, glycation, inflammation, axis in malignant and metastatic cancers. So why would we be looking at AGEs and the product as well? Adverse effects and the role of autophagy, we will talk about that later. And they suppress AGE's mitochondria function. And in this case, this study was on the negative impact it had on the Achilles tendon fibroblasts. So this is where AGEs get into affecting the skeletal system and cartilage and cytoskeletal system. And altered proteostasis, I don't know. So altered proteostasis is protein folding, and protein folding is in our second part of this program where we'll go more in depth, but it's huge, particularly in brain issues, but it's huge in everything. I was just wanting to give you some reference to know that I wasn't just being very creative. Glycan-3, I don't want to go into that right now, but it's associated with AGEs as well. And glycan-3 is a high marker for chronic heart failure, and AFib are dependent on the AGE and renal function. So, or age and renal function. I did a presentation on glycan-3 last year on its association to cardiovascular disease and brain disease. And we all know what helps lower abnormal galactin-3, because abnormal galactin-3 is not healthy for you, can damage the brain, the heart, the kidneys, etc., and promote fibrosis. What lowers it? MCP-F, one of Inno-Vita's products. Impairs cardiac atrial appendage and stem cell properties. So again, it's showing how it inhibits, or it can affect cardiac function and stem cells associated with that. Okay, here's where it gets real nasty. When AGEs produce sustenance cells, in this case of the heart muscle, and it's not just the heart muscle, but this research was about the heart muscle. Sustenance cells are zombie cells. Again, I did a presentation 2 years ago on that. And again, this is showing you more structural issues associated with advanced glycated end products, which are associated with food consumption, playing a huge role in musculoskeletal problems, which I don't know if everybody would have thought of this before. And here's intervertebral disc degeneration. How many of you said, oh my gosh, this person's got an IVD problem with their disc. We need to think about using Motilia and nutritional support for the disc and other products. But you might want to rule out AGE formation as being a contributing factor to promoting accelerated degeneration of that soft tissue. Diabetic fibrosis, so AGEs contribute to fibrosis of the pancreas. And again, fibrosis we'll get into in part 2. Infertility. 1/3 is caused by the man, 1/3 is caused by, these are the statistics I'm aware of. 1/3 is male, 1/3 is female, and the other third is both parties. So in this case, they show that AGEs can contribute to low quality sperm. Again, I don't know how many of us would think AGEs might have a direct or indirect effect on quality sperm. Eye diseases, and I put these in here because it's so easy just to think of AGEs and diabetes, or AGEs and insulin resistance, and AGEs and cardiovascular, but I want you to, it's across the board, and that's what I'm hoping you're getting out of this. Here is pathology of eye diseases associated with it. Osteoarthritis, again, another structural bone situation. Molecular aging, so this is something I've spent the last 13 years going anywhere and everywhere around the world on the aging process, because I want to be younger, feel younger, and live longer. So that's the reason why. And so AGEs have an impact on cellular aging, which we all know we live and die on a cellular level. And we're getting back to AGE and cancer and metastasis and diabetic neuropathy. So again, there's a lot of neuropathy out there. If there wasn't, there wouldn't be neuropathy ads everywhere on the internet. So I'm sure you either have or know of people with neuropathy or have people with neuropathy. Now is a good time to think about AGE. And the second part of this program will go in the other thing that also plays a big role. Besides, what else do we know has a dramatic impact on decreasing neuropathy? Sirtuins. If you remember anything about my sirtuin presentation, go back and watch it. Sirtuin, I think it was sirtuin 3. The researchers claimed that it reversed neuropathy. They didn't say, in some cases, most of the time, they were definitive. Cardiac fibrosis, again, huge deal. This is when we're getting in the fibrosis stages and the cellular sustenance stages, we're passing a red line in the sand, so to speak, and some major changes have to happen. And the anti-fibrotic properties of receptors for AGE products in pulmonary. So in other words, they know that there's certain things that inhibit fibrosis, and they know it's based upon decreasing the AGE levels. In this case, in pulmonary fibrosis. Liver fibrosis, again, I just want you to get a real round understanding of how AGEs play such a huge role in things like fibrosis and other health issues. In this case, it causes kidney fibrosis, kidney transplants, people on kidney dialysis, all this stuff. AGE is one piece of the puzzle that had been going on for many, many years and not addressed. Microbiome, gut microbiome. So I've not heard anybody talk about AGEs and the gut microbiome and the effect it has on the microbiome and causing leaky gut syndrome. So now you have these are studies. It's not Dr. Martin's opinion. Hashimoto's thyroiditis. How many thought autoimmune thyroiditis of the thyroid could have AGEs could play a role in it? Here's one study showing that it does. And there are other studies. I'm trying to keep it minimal. Again, another study on the gut microbiome and insulin resistance associated with AGEs. Multiple sclerosis. I will tell you if I don't have a slide in here that makes that association between AGEs and autoimmune diseases. If you see enough of these studies, which I've seen, tons of them, there's a high correlation between AGEs and a lot of the autoimmune diseases. Stem cells, again, with AGEs causes apoptosis, which means it kills the stem cells. Again, on stem cells, so AGEs disrupt healthy stem cell function. So if you're getting that shot, and I know I sound like I'm really poo-pooing stem cells, and I guess at this point in time I probably am, but it's not that I don't think they have a phenomenal future. I just believe they haven't got it down to where it needs to be for us to have the benefits, particularly nowadays for the price we pay for it. Adipose tissue, yes, we know, it causes what? Insulin resistance, hypothalamus resistance. So it plays a big role in your weight loss programs. It's just something to look at. Oh, that's endothelial fibrosis, meaning stiffness of the arteries, right? Okay, liver damage, we know. Cystic fibrosis, worse lung function, high AGE. So next time you have your lung function issues with COPD and that, think about AGEs as well. Kidney fibrosis. Okay, here's a nice poster, which actually I have this up for my staff that work in the nutritional case manager level of our facility. So they know the impact that AGEs have on all these different areas of the body and what associated health issues. So this is a good overview just to look at. So you can sit there and look at it and say, oh my gosh, immune system effect, vascular system effect, pancreas, brain, GI. So this is a nice slide to have if you're trying to educate your staff or if you're trying to educate your clients. This is probably the slide to show them when you're testing for AGEs. Again, more health conditions associated with high level AGEs. And this is how you reduce it. Obviously, by the way, sun damage promotes AGE formation. So that wonderful, beautiful tan people get, which is essentially radiation poisoning, is creating AGEs. Sleep, stay hydrated, balanced diet, limit sugar intake, particularly high fructose corn syrup, lower blood sugar levels. Exercise as well. Doesn't have to be strenuous exercise. It can diminish it. They know studies that it can show it can reduce it. And reduction is linked to improvements in insulin sensitivity, reduced fat mass, lower inflammation. Here's the products. Use them, test them, do the test, find out the levels. If you're not going to do it by the test, then however you test to figure out if they need it, I would suggest you put it as a part of your protocol for at least testing. When we do section 2, I hope I give you more information on the subject matter that you haven't already heard in part 2. Thank you guys very much.